Greetings and welcome. My name is Selena Belisle, and I am the founder and one of the board-approved CE providers teaching all types of hands-on therapy here at CE Institute. We primarily teach to the Florida Board of Massage licensees, Board of Nursing licensees, and Board of Cosmetology licensees here in the state of Florida. We also teach NCB TMB approved courses, so we have massage therapists usually nationwide taking training with us when they accept NCB TMB hours. And we also have people who are licensed but not in our class for CE credit. They're just here to learn more skills, which is great. The one trending theme that we have here is those are just about all licensed healthcare professionals, and we want you to have completed rudimentary healthcare training, which includes learning about pathologies, infectious diseases, contraindications, precautions, and more, so that you do no harm with your hands-on practice, including doing no harm to yourself. So please do not practice these techniques unless you've completed some basic healthcare training to ensure you are on the right path. In this training, this is a unit that comes from our neuromuscular therapy home study class, and we're going to teach you how to bring joints to range of motion and work on muscle at the same time. It's a little bit more advanced technique. It's kind of like bouncing on one foot and scratching your head and tapping your belly at 3 different speeds, but it's really effective and people love it. And we're going to show you how to do it on yourself instead of a live model, so you can practice it and feel it and enjoy it and kind of see some of the things we're doing here at the school. Now, we usually work on live models or each other in in-person training, but when we're doing home study, sometimes we come up with activities where you can work on yourself too, which makes it more convenient to study from home. So here is one of our neuromuscular therapy units in teaching strumping here at CE Institute. In neuromuscular therapy, we practice something here at CE Institute called strumping. Strumping is STR is for stripping the muscle, and the umping, UNPING, is for pumping a joint at the same time we're applying stripping techniques to the muscle. Your stripping techniques are usually force or pressure from your own hands and forearms and elbows into the client's muscle while there's some type of movement. It could be an active release technique where the client is actively moving, or it could be a passive technique where we're going to move the client's joints while we strip their muscles. Now, when we practice this strumping on ourselves, I'm going to let you decide whether or not you want to apply lotion with any of these strumping techniques. That choice is yours. It's also yours and the client's when you work on a client. If you don't use any lotion for some of the neuromuscular techniques that we're going to share with you, it's going to be more intense and more aggressive work. You're also going to be pulling on the skin as well as the underlying soft tissue and muscle when there's no lotion or lubricant applied. I prefer lotions and creams. Ben Benjamin, who teaches some of the advanced body work here at CE Institute, he prefers oil. So it's a practitioner's choice what they use for lubricants when practicing body work. You likely have a favorite. You should use what you're used to instead of trying to use what feels good to me or Ben or any other master practitioner, because if it doesn't feel good to you, it likely will not be a very good medium. Now, on the next slide, we're actually going to be strumping ourselves, and hopefully you'll be strumping with us on your own self too. However, when you're practicing strumping techniques on your paying clients and even on yourself, you might want to warm up your tissue first. Now, this is neuromuscular therapy training. This is not basic Swedish 101. So I'm going to rely on you to warm up your own soft tissue. You can do circular effleurages or whatever you wish. If you're going to start strumping right away, do so lightly with less pressure. Don't work at a 7 right away. okay? Because it's usually good practice to warm up the tissues first, make them a little bit more pliable. It's known that when tissue becomes warmer, it is more pliable, especially fascia. So let's make sure that the tissue is nice and warm before we do more aggressive techniques, whether it's right now with the strumping on ourselves or later on with our live model practice. You would never just dig right in unless you're seeing the client every day and they're used to aggressive body work. If it's a once a week client or even less than that, always warm up the tissue first. Decide whether or not you're going to use lotion before practicing some of these more aggressive techniques. So I've changed into a sports athletic top, and I put both sides of my straps here on one side to access the pectoralis major, and I have some yoga pants on. Feel free to do the same for yourself so that we can work on ourselves. Also, make sure you removed any rings or jewelry that you have. Wash your hands, make sure your fingers are trimmed, the fingernails and so forth, so that we're safe when we're practicing on ourselves right now. Now for strumping, we'll start off on the chest, number 1. We're going to use our second knuckles when we work on ourselves in this strumping exercise. Your second knuckles are your second interphalangeal joints. And what I'm going to have you do is bring your arm out to maybe like a 90-degree angle to your body. We're going to have you insert your second knuckles somewhere around where pectoralis major starts inserting into the humerus here. We're going to lift our arm above while pulling down. You can actually see the white marks where my knuckles stretched really well in that pectoralis major. You can see that white knuckle effect again right there. And I just want to open up my pectoralis major, okay? If you have anteriorly rotated shoulders, maybe as a massage therapist massaging all day, this might be wonderful to do on yourself to keep your pecs a little bit looser. And you can go at different angles. We can go more medially, or you can do inferiorly, or you can do a 45-degree angle, or whatever makes most sense for you. I'm going to take my top, I'm going to bring it to the other side. Let's do the other pectoralis major, right? Let's bring it up to a 45-degree angle. Get your knuckles inserted there. We're going to bring the arm up overhead as we bring our knuckles down, and same on this side. You can really see where I'm knuckling through. I'm using substantial pressure because I want to get a really nice stretch on that pec. And I am getting, I'll move more up into pec minor up top here and pec major and pull up. We'll do it one more time. And I'm pulling and drawing down inferiorly with my knuckles as I move my arm in extension overhead. And that's a great way to strump your own pectoralis major. The next thing that I'm going to do here is my forearms, okay? So when practicing on your forearms, you want to brace your forearm on a table or a desk, and it'd be best if you hung your hand over the side of it, okay? And when we're hanging over the side of it, this is going to be an active release technique where we're going to close our hands and open our hands maybe every 3 to 5 seconds, okay? So with our hand hanging over the side of the table, we're going to take our second knuckles, okay? Those are the second interphalangeal joints. I'm going to take our second knuckles, and we're going to actually start opening and closing our hand, and we're going to pull superiorly or proximally with our first knuckles backwards, kind of with a supinated hand, up to the lateral epicondyle. Stop when you get here because we don't want second knuckles on the epicondyle. That'd be bone on bone and that would hurt. Let's do it again. Ready? We're going to start opening and closing. And we're drawing our second knuckles up, opening and closing, and that feels lovely. Let's do it on the other forearm. Ready? So we're going to have our hand over the side of the table. I'm going to take our second knuckles right there, the second knuckles. We're going to insert them above the carpals. We're going to open and then close nice and slowly. This is an active release technique. So we're actively moving. We're going to have the clients do this in neuromuscular therapy training. This is something that I'll never forget with Paul St. John's class. Now, if the pressure is a lot, make sure you release pressure. You don't need to do one big long stroke all the way up to the epicondyle. You can release and then put pressure back in. We don't want the blood to be so excessive in the capillaries that all of a sudden you're bursting capillaries here. Okay. So one last line along the forearm extensors. I'm going to pull up with those second knuckles as we continue to open the hand and close it very slowly. Now we're going to do the forearm flexors. You don't need to let your hand hang over the table for this because while your hand is supinated, it's very easily openable. You can open and flex your fingers and extend and open your fingers, right? So we're going to continue that active movement of opening and closing your hand every 3 to 5 seconds with movement in both directions. We're going to continue to use our second knuckles. We're going to insert our second knuckles just above the carpals, and we're going to start opening and closing that hand. It doesn't have to be tight hand squeezes. We're going to release pressure to allow blood circulation, and we're going to continue all the way up to the cubital fossa, opening and closing. Now, we don't massage back down. This is not a massage. It's neuromuscular therapy. We're trying to achieve function here, releasing fascial adhesions, releasing muscle tension, increasing circulation to relieve ischemia, and more. We'll do it one more time on this side. Second knuckles above the carpals. We'll do this a little bit more medially. I'm going to start opening. We're going to pull back superiorly or proximally towards cubital fossa. And that's how it's done. Let's switch hands. You can do this as many times as you wish. This is just a little practice session so we can do it all together. Again, second knuckles, pulling backwards as we open and close. Release pressure so you're not making bruises on yourself. Do not go in the cubital fossa. And work more laterally here. Ready? We're going to open right on the top of the carpals there. Open and close. It's easier to close with this than it is to open because we're pulling on the flexors. Open. And don't go in the cubital fossa and close. And that's strumping and stripping your own forearms. So the next area in our own body where we're going to practice strumping on ourselves is our triceps. Okay, I'm going to turn my my chair here a little bit sideways because we're going to place our arm about at a 90-degree angle to your body. And then I'm going to flex my elbow here, right? Because right here underneath the elbow itself is where I'm going to place my second knuckles. Okay, so that's where I want the flexion. So what I'm going to do is I'm going to flex my elbow as I draw proximally with my second knuckles in a supinated position. Ready? So we're going to flex the elbow as I draw proximally or superiorly with my second knuckles. I can't believe how good that feels. I need a massage. This is a nice stripping technique for the triceps. Okay, if you don't have a massage therapist available, maybe we get another spell of another pandemic where we're all going to be in self-isolation again. It's a great technique to work on you. And you can strump your own clients too. This improves ischemia, gets circulation going. You want to stay on any area that you find trigger points. Let's work to the other side. Ready? I think we got the hand in this. This is pretty easy. We're going to take those second knuckles. I'm going to extend the arm forward. Okay, and then let's flex as we draw superiorly or proximally. Make sure your knuckles don't go into the axilla. That's unnecessary. And here, the circulation is a little bit better than maybe in the forearm, so we don't need to release that pressure so much. With your thumb, I put it inside my hand. You can have it on the outside. It was a little bit in the way. I'm just actively moving and flexing my own elbow as I work up from the elbow itself, from the olecranon process, through the triceps, pulling with my second knuckles proximally, working superiorly towards the axilla, getting a really nice stretch on those triceps. The next thing I'm going to do here is my quadriceps, okay? What I'm going to do is I'm going to extend my leg. It's no longer flexed, it's extended, and I'll turn to the side a little bit here so you can see it better. And I'm going to take my knuckles, my second knuckles as usual, and I'm going to take those second knuckles, insert them just above the patella, kind of on the patellar tendon. I'm going to pull my pants tight here because I'm going to start drawing superiorly or proximally as I drop my leg over the table, as I flex my knee. And what this is doing is we're stretching the quadriceps as we flex the knee. I'll raise the camera a little bit higher here now that you can see what I'm doing with my knee and flexing it. So I'm extending my leg again. I'll insert my second knuckles over here along the vastus lateralis, right? I'm going to insert, and as I start flexing my knee, I'm going to draw superiorly or proximally back towards my hip to give a nice stretch to that vastus lateralis muscle, part of the quadriceps, right? Let's turn around and do the other leg. You ready? You can do these as many times as you wish. This is just an instructional video, so you can learn how to practice it and then apply to yourself or your clients, adapting it in a way that makes sense in the treatment room. We're going to take our knuckles here and we're going to strump the other quadriceps. So we're going to insert our knuckles just above the patellar tendon. My patella is right here. I'm going to flex my knee and pull with those second knuckles along rectus femoris here. We're pulling backwards superiorly and proximally. I'm going to extend my leg, my knee one more time. I'm going to take my second knuckles. I'm going to work more on the vastus lateralis now, maybe catch a portion of the iliotibial tract. So I'm just above the knee, the lateral epicondyle, and I'm going to start pulling backwards as I flex my knee along vastus lateralis. What a nice stretch. I hope you're getting this too. And that is how we would strump the quadriceps. Now I'm going to work on tibialis anterior. Tibialis anterior is the muscle that's just lateral to the tibia itself. You can feel the tibia bone on most people, okay? And we're going to work just laterally to that, all right? So what we're going to do is we're going to insert our second knuckles just above the malleolus here, okay? And we're going to start pulling backwards, drawing superiorly and proximally up towards the lateral epicondyle. Now, when we do this, we are going to start flexing and extending our foot. Plantar flexion, dorsiflexion, plantar flexion, dorsiflexion, while drawing superiorly and proximally towards the lateral epicondyle of the knee. That's where it's going to stop. Let's do it one more time. Ready? We're using our second knuckles. We're inserting these along tibialis anterior here. And we're going to start flexing and extending. Flexing and extending as we draw up. Now I'm lifting my leg up so you can see it in the camera view. You can just leave your leg on the table. And boy, does that feel nice. Anybody who has shin splints or a history of shin splints will probably really like that. Now we're going to move over to the second leg. Okay. We're going to take our foot. We're going to start flexing and extending, right? Dorsiflexion, plantar flexion. We're going to pull up, drawing proximally with our knuckles. You might see a nice white line where you've depressed as well, all the way up to the knee. Let's repeat that one more time. Ready? We're going to flex and extend, flex and extend, flex and extend, all the way up to the lateral epicondyle, and you are done. So we hope you enjoyed strumping yourselves and getting some self-care in there, in addition to maybe learning some new skills or learning how to apply different approaches in some different areas of the body. That's going to conclude this free training for now, but if you want to learn more, we have many pre-recorded home study classes available at ceinstitute.com where you can register for training and start immediately. It's available to you 24/7 after you register until your course access expires. This was part of the neuromuscular training, but you'll see strumping at our school being applied in sports massage, medical massage, and many other modalities that we teach too. And until we do see you in a training, we hope that you be safe.